All right, hey everyone, this is blockchain in the healthcare space. So we're going to talk about three primary problems. The first is interoperability. This is the way different healthcare providers are able to share, search, and query medical records. So contemporary healthcare information systems are highly fragmented. There's an inability to determine patient information. For instance, what medications are you allergic to? What is your family medical history? Second point on this is information blocking. There can be restraints on exchange of patient information due to policies and practices. Hospitals don't want to lose patients, and unfortunately, they block information in order to do this. Another point is data corruption. Errors in patient data, old information such as patients no longer being diabetic, very important stuff. Up to 20% of patient records are inaccurately matched within the same healthcare system. This number goes up to 50% when we talk about transferring between healthcare systems. So security is the second point we're going to talk about. Between 2009 and 2017, more than 176 million patient records were exposed in data breaches. Perpetrators stole everything from credit cards to genomic testing records. Health information exchanges that do exist are centralized and mutable. They own the patient data. The last point we're going to talk about is clinical research integrity. There's a lack of transparency in pharmaceutical clinical research, and this is because there's a potential of improperly recorded or even fraudulent data.
So the solution that blockchain can provide to the first problem of poor interoperability or fragmented system of healthcare information is to create a universal electronic health record, which is the primary and most popularized application of blockchain to the healthcare industry. Having a global ledger of all patient medical records would enable efficient and reliable transferring of real-time medical data by patients, hospitals, and healthcare providers, because it can bypass organizational boundaries, which would increase the quality of patient healthcare. At the same time, privacy can be maintained on the public ledger because of the nature of blockchain cryptography, which provides anonymity and additional security, which helps to solve the current issue of vulnerable medical records. Many people are also concerned with the integrity of the healthcare industry with regards to pharmaceutical product development, where clinical data may be improperly recorded or even fabricated. Blockchain features like timestamps and the fact that it's tamper-proof can allow data sets provided by clinical researchers to be authenticated, and that helps agencies like the FDA to approve only safe and effective drugs. Some other applications of blockchain within the healthcare industry could include the prevention of double filling prescriptions, much in the same way that Bitcoin helps to prevent double spending of unspent transaction outputs. And the feature of private keys can also be applied to authenticate identity and insurance coverage. And it can also be used to track and authenticate pharmaceutical products, which touches on the use case of logistics. And lastly, to provide a contemporary example, blockchain can be used in healthcare for vaccine tracking, like with COVID. A feature that you would have as the result of a universal electronic health record would be that you can ensure, regardless of where someone had their vaccine administered, that they received the correct type and the correct dosage over the correct intervals. And because you have an immutable and tamper-proof record of vaccination, you could have digital passports that verify admission of people to public events or for international travel, rather than having them to recover and provide or upload proof of vaccination and remember dates and locations that they received them.
So in terms of the practicality of our use case, we related what we have to the NIST framework. This has helped us identify our main challenge in that we will be storing plenty of sensitive information in the blockchain, which may cause security issues despite the data being encrypted. This makes our major challenge security to ensure that patient information does not end up in the wrong hands. A more practical problem we may meet is the lack of industry acceptance. This cause essentially dies without the cooperation of the majority, if not all, medical institutions. And if we aren't eventually incorporating a majority of institutions, the blockchain is essentially operating on limited resources. So as early as 2012, the country of Estonia was looking into implementing blockchain technology on the healthcare front. In 2016, they formally launched a development project aimed at protecting patient health records using blockchain. In present day, 95% of health information is ledger-based, and 99% of all prescription information is digital. EHR data is another example of blockchain being used in healthcare. The main goal of EHR data is to establish a global patient record, which is really similar to the case that we've theorized. The global patient record would contain patient information that is accessible by relevant medical institutions. Our third example of real-world implementation is Veridat, which addresses the clinical research data side of healthcare. Veridat uses the blockchain to establish credibility in research data and ensures that the data is accurate and legitimate. So that brings us to the end of our presentation. Thank you for listening.